Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. The topic of my lecture today about aesthetic gynecology. So, what we wanted to discuss today, the introduction of aesthetic gynecology, definition, prevalence, types, the procedures, and the recommendations by the American College of Obstetrician and Gynecologists 2020. Let us start our journey. So, many girls and women consult gynecologist, plastic surgeon, or general practitioner about the structure and the appearance of their genitalia. Is it looking normal or there is something abnormal like that? Okay. What is the opinion of some women and girls? Each part of their body sometimes is not as perfect as they want it to be. Sometimes it can cause not only aesthetic problems, it can make their life miserable and painful. Women are also don't want signs of aging appear on their private parts. So this is the opinion of some girls and women. One cannot give an exact description of the normal view of external genitalia. As you see in this picture, this is a picture of external genitalia with mons veneris, labia majora on both sides, labia minora in both sides, and the clitoris at the middle at 12 o'clock, and the prepuce of the clitoris. Okay, so what is the normal? There is controversy about this point. However, upon consideration of anatomic variation, Hodgkinson and Head defined the ideal aesthetic picture of female external genitalia as the one in which the labia minora are small and not larger than the labia majora. But the Panwell classification categorizes labia according to their shape and the morphological variation. None of the classification systems has been accepted by gynecologic or plastic surgical societies and are rarely used. So up till now, there is no worldwide classification about the normal shape and the morphology and the variation of external female genital. No one is accepted by European societies or United States societies. Okay, what is the definition of aesthetic gynecology? It is aesthetic procedures to improve the cosmetic appearance of the external, vulvar, or vaginal region. These procedures include labiaplasty or labia minora reduction with or without excess prepuce reduction, labia majora reduction or augmentation, vaginal introital repairs for cosmetic issues, as well as reduction of lipodystrophy in the mons pubis region. Is there any prevalence or any incidence? Up till now, there is no documented prevalence of these procedures because we are lacking published studies and lack standardized nomenclature related to female genital cosmetic surgical procedure and their outcomes translates to a lack of clear information on incidence and prevalence and limited data on risks and benefits. However, both patients' interest and performance of cosmetic genital procedure have increased during the past decade. Okay, let us look to some types of procedures, surgical procedures, energy-based intervention, and injection. Surgical procedures like clitoral hood reduction, labiaplasty, labial augmentation, hymenoplasty, vaginoplasty. What is the energy-based intervention? Including laser treatment for vaginal laxity as after childbirth or after menopause, or radiofrequency vaginal rejuvenation. Okay, also done in cases with skin atrophy after menopause or skin changes of the vagina after childbirth. Let us go to the third group, injection. G-spot amplification by injection of collagen or fat in the area suggested to be site of G-spot. However, G-spot itself, there is a controversy about it and its role in vaginal orgasm. Okay, another fourth group you can consider lightening of the vulva as a management of darkly pigmented vulvar region. Okay, look to this table, please. This is different surgical procedures, types, what is the suggested benefits, what is the procedure, and what are the complications. Let us start with clitoral hood reduction. May improve sexual function by increasing sensitivity and allowing more direct clitoral contact. The procedures is done by hodectomy, but sometimes associated with labiaplasty to create labia minora symmetry and prevent clitoral hood sagging. But the complication should be considered, like scarring, like infection, like hematoma, like hypersensitivity, like damage of the glands. And this is catastrophic. You may distort the area, you may do hazardous complication. Okay? Second operation is the labiaplasty to eliminate unwanted tissue of the labia minora or labia majora. What is the procedure? Frame or edge resection, wedge resection using V-shaped or Y-shaped incision, de-epithelialization, Z-plasty. What is the complication that may happen? Also scarring, infection, hypersensitivity, or loss of sensation, dyspareunia, wound dehiscence. Of course, complication should be considered. Okay, this is the picture showing you the labiaplasty. As you see in this picture, this is before and this is after. The third operation, labia majora augmentation, to create a full symmetric lock. Okay, this is the suggested benefit from this operation. What is the procedure? Autologous fat transplantation, okay, in the labia majora. Injectable fillers like hyaluronic acid in the labia majora. What is the complication? Palpable fatty cysts may happen. Okay. The later operation is the hymenoplasty to recreate virginal state of the hymen. Has cultural roots in regions that place a value on an unmarried woman's virginity. What is the procedure? Reconstruction of hymenal remnants, vaginal mucosal flaps, or both. What is the complication? Wound dehiscence. Lastly, vaginoplasty to tighten vaginal contour and increase sexual satisfaction. What is the procedure? Anterior, posterior, or lateral colporrhaphy, restoration of regae, vaginal regae. Energy-based devices also can be used for this, as we will see later on. What is the complication that may happen? Infection, dyspareunia, dehiscence, and the fistula. Okay. Other procedures like energy-based intervention and injection. What is the energy-based intervention? Like laser, radiofrequency, and radiofrequency devices. The suggested benefit to tighten vaginal contour and increase sexual sensation, but the complications include burns, scarring, pain during sexual intercourse, and recurring and lastly chronic pain. What about the injection? G-spot amplification. To augment G-spot and increase sexual satisfaction by autologous fat transfer in this area of G-spot or hyaluronic acid. Okay? But the complication include urinary tract infection and infection at the site of injection or transfer of autologous fat and hyaluronic acid. As you see in this picture, this is the radiofrequency vaginal rejuvenation. What about vulvar lightening? We can use CO2 laser. Also, you should avoid rebound hyperpigmentation. Hyper and hypopigmentation can occur with the use of energy-based devices such as CO2 laser to lighten the area. What about the use of radiofrequency in an ablative manner? Also can result in both hypo and hyperpigmentation. But if you use non-ablative radiofrequency, you can avoid these pigment issues. So lastly, what is the recommendation of the American College of Obstetricians and Gynecologists 2020? First, patients should be made aware that surgery or procedures to alter sexual appearance or function are not medically indicated and carry substantial risk, and their safety and effectiveness have not been established. Okay? Okay. But at the same moment, we exclude from this the procedures performed for clinical indication, like clinically diagnosed female sexual dysfunction, pain with intercourse, interference with athletic activities, previous obstetric or straddle injury, reversing female genital cutting, vaginal prolapse, or incontinence. Because in these situations, there is clear cut indication for operation and surgery. Okay? This is different than just cosmetic purposes or patient request. Okay? Okay. What is next recommendation? Women should be informed about the lack of high quality data that support the effectiveness of genital cosmetic surgical procedures and counseled about their potential complications, including bleeding, pain, infection, scarring, adhesions, altered sensation, dyspareunia, and the need for reoperation. Okay? Gynecologists should have sufficient training to recognize women with sexual function disorder as well as those with depression and anxiety and other psychiatric conditions. Individuals should be assessed if indicated for body dysmorphic disorder. In women who have suspected psychological concerns, a referral for evaluation should occur before considering surgery. As I put in this table to refresh your mind about the classification of female sexual dysfunction, like impaired sexual desire, impaired sexual arousal, orgasmic disorder or dysfunction, dyspareunia, vaginismus, or sexual phobias. So gynecologists should be aware of about all of this, okay? Because the problem may be sexual dysfunction. Okay, and responding to patient concern about the appearance of her external genitalia, the gynecologist can reassure her that the size, shape, and the color of the external genitalia vary considerably from woman to woman, from girl to girl. Okay? Okay. These variations are further modified by pubertal maturity, aging, anatomic changes resulting from childbirth, and the atrophic changes associated with menopause or hypoestrogenism. As for all procedures, gynecologists who perform genital cosmetic surgical procedures should inform prospective patients about their experience and surgical outcome. And this gynecologist should be honest with his patient about this, about the risks, about the complications, about if it is indicated or not, or if the patient will get benefit from this or not. This is very important. And by the way, the subspecialty in gynecology which may concern about this type of operation, aesthetic gynecology, belong to urogynecology subcategory. Okay? Okay, this is very important that advertising in any media must be accurate and not misleading or deceptive, because we see many misleading advertisement in the media. Okay, so it should be accurate and not misleading. Okay, rebranding existing surgical procedures, many of which are similar to it, to, if not the same as, the traditional anterior and posterior colporrhaphy, and marketing them as new cosmetic vaginal procedures is misleading. Yes, some believe that this is different operation. No, if it is just anterior or posterior colporrhaphy, you just tell the patient like that. Don't rebrand existing surgical procedure in a different name and they say this is anesthetic gynecology and or this cosmetic surgery. No, you should say the truth, which is if it is anterior colporrhaphy, you should say it like that. Thank you. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.